Hi, good day everyone. My name is Patrick Merida Rabino and I will teach you about drugs acting in central nervous system. And let's proceed to our topic outline. We will discuss about the introduction, definition of the drugs, and its clinical considerations. Our main objective in this module is to distinguish sedative and hypnotic drugs by comparing the pharmacologic actions and pharmacokinetics of each drug class. Differentiate the different drugs in each pharmacologic class by comparing their pharmacologic characteristics, and lastly to appraise the benefits of sedative hypnotic drugs by presenting a discussion on the use of the drug in oral healthcare setting. And let's go for the introduction. At some point in our lives, we felt anxious. We felt anxious in our upcoming exams, anxious whether we are going to pass or not, and anxious regarding the ongoing pandemic scare. For some, these anxiety attacks are merely episodes, but for some it lingers, that it cripples their daily activities. For these people with special needs, a sedative hypnotic drug may be able to help them calm so they can go about with their daily routine. Drugs acting on central nervous system. First, we have the sedative anxiolytics. These are a class of medications aimed at treating patients with panic disorders, generalized anxiety, and various other uses. Sedatives like hypnotics are a class of drugs used in different situations, ranging from treating insomnia to treating someone connected to a mechanical ventilator. Second, we have antidepressants. Antidepressants, just from the name itself, are medications used to treat major depressive disorder or when someone has anxiety disorders, some chronic pain conditions, and to help manage some addictions. Common side effects of antidepressants include dry mouth, weight gain, dizziness, headaches, sexual dysfunction, and emotional blunting. The third one is in antipsychotic drugs. Unlike the drug mentioned before, this drug, also known as neuroleptics, are a class of psychotropic medication primarily used to manage psychosis, principally in schizophrenia, but also in a range of other psychotic disorders. They are also the mainstay, together with mood stabilizers, in the treatment of bipolar disorder. Fourth one, we have anti-manic agents. Anti-manic agents are psychotropic drugs that are used to treat symptoms of mania. Though there are different causes of mania, the majority is caused by bipolar disorder. Therefore, anti-manic drugs are mostly similar to drugs treating bipolar disorder. Here are some samples of anti-manic drugs: Abilify Maintena, Aristada Inicio, carbamazepine, and other more. Commonly used CNS acting drugs and their clinical and dental implications. First, we have sedative anxiolytics. Drugs in this particular class have the ability to calm, induce drowsiness, or promote sleep. These effects generally follow a classic dose-response pattern. For example, a drug marketed as an anxiolytic is formulated as a lower dosage than if it were to be promoted as a sedative or hypnotic for insomnia. Several of these agents are prescribed as skeletal muscle relaxants, but this effect is likely an extension of their anxiolytic properties. Trilytic antidepressant are so named because of their three-ringed molecular structure. They differ in their propensities to inhibit neuronal uptake of either norepinephrine or serotonin. Formerly, this was believed to be provide a basis for prescribing specific agents for selected patients, and perhaps offered a biochemical basis for classifying various forms of depression. Amitriptyl is generally regarded as the prototype of this group of antidepressants, but today it is more commonly used in the management of insomnia and chronic pain. Proceed to our clinical considerations. First, we have the antidepressants. Antidepressants that elevate serotonin levels are a concern if taken along with other medications that enhance serotonin levels. This can lead to a so-called serotonin syndrome, characterized by hyperpyrexia, confusion, agitation, and neuromuscular irritability. Dental implications for patients medicated with antipsychotic drugs. There are no well-established drug interactions associated with antipsychotic medications and drugs conventionally used in dental practice. However, some consideration may be given to the use of vasopressors in local anesthetic solutions and the use of antihistamines and antiemetics used in sedation regimens. Most antipsychotic agents have modest alpha-blocking actions that may counter any increase in systemic vascular resistance following systemic absorption of vasopressors contained in local anesthetic formulations. The other one is dental implications for patients medicated with lithium and anticonvulsants. All anticonvulsants have these sedative properties, but patients without problem develop tolerance to this influence within a few weeks of use. Nevertheless, this property should be considered when administering sedatives. Patients with chronically medicated with clonazepam or clonazepate invariably develop tolerance and independence to benzodiazepines. This is problematic when choosing dosages for oral sedation, but carefully intravenous titration of benzodiazepines is generally. Thank you for listening. I hope you've learned something on drugs acting on central nervous system.
Okay guys, so as per continuation of the previous module, here is the second part of module reporting, which is entitled as Drugs Acting on Cardiovascular System. So, just as drugs have varied effect depending on the type and purpose, certain drugs also have positive and negative on the cardiovascular system. In this chapter, we will discuss all about the drugs acting on the cardiovascular system. So here is a concept map of the discussion for this chapter. The first one would be the common cardiovascular diseases, the digitalis, beta blockers, calcium channel blockers, antihypertensive drugs, antiarrhythmic drugs, antiandrogenic drugs, vasodilators, antihyperlipidemic drugs, and antithrombotic drugs. So, what are the types of cardiovascular diseases? The first one would be coronary artery disease. This is the buildup of plaque in the arteries supplying blood to the heart. The second one would be the peripheral artery disease. This is the buildup of plaque in the arteries supplying blood to the arms and legs. And the last one would be the carotid artery disease, which is a buildup of plaque in the arteries that supply blood to the brain. Now, we go to the types of drugs that act on the cardiovascular system. The first one would be digitalis. Digitalis is a genus of about 20 species of herbaceous perennial plants, shrubs, and biennials, commonly called foxgloves. The extract from the foxglove leaf and some other plants is what makes up digitalis. Digoxin is the only derivative currently in use for this drug. What is its mode of action? Digoxin has 3 modes of action in the body. The first one would be positive inotropic, meaning that it increases contractility of the muscles of the heart. The second one, which is divided into 2 electrical influences, namely the negative chronotropic, which decreases heart rate, and negative dromotropic, which decreases velocity of impulse conduction within cardiac nodes. Take note that the use of digitalis for heart failure has increased due to better results achieved from vasodilators. In terms of pharmacodynamics, it is currently used in treating chronic atrial fibrillation, which is a state of irregular and often rapid heart rate that can increase your risks of strokes, heart failure, and other heart-related complications. It depresses the atrioventricular node, therefore blocks passing of unnecessary atrial impulses to ventricles. Therefore, the patient remains in atrial fibrillation, but the ventricular response is just slowed. What are the adverse effects of digitalis drug? The first one is cardiac, which is palpitation and syncope due to various arrhythmias. The second one would be neurologic, malaise, fatigue, confusion, vertigo, blurred vision. And the last one would be for the gastrointestinal, which is anorexia, nausea, vomiting, and diarrhea. What are its dental implications? Record the baseline pulse rate and rhythm before commencing dental treatment. Second, take caution when administering epinephrine or anticholinergics that may lead to added cardiac excitation. And the last one would be macrolide and tetracycline antibiotics should be avoided because they elevate digoxin serum concentration and enhance the risk for digoxin toxicity. The next type would be beta blockers. Beta blockers, also spelled as B blockers, are a class of medication that are predominantly used to manage abnormal heart rhythms and to protect the heart from a second heart attack, which is also known as myocardial infarction after a first heart attack. These are drugs that act as antagonists on cardiac beta receptors. They are used in management of angina, arrhythmia, and hypertension. And propanol is the prototype beta blocker. What is its mode of action? It blocks beta receptors, therefore inhibiting stimulatory effects of sympathetic system, thus resulting in heart rate reduction. Beta receptors are also present in the lungs, blocking of which may lead to bronchial spasms. Due to the advancements of medicine, the newest generation of beta blockers have alpha blocking properties that vasodilate and reduce afterload on a failing heart. Therefore, beta blockers are used in managing heart failure. What are its dental implications? It is used for treating patients' medication with non-selective beta blockers. It is wise to record blood pressure and heart rate before administering local anesthetic vasopressor formulations. Then, reassess those parameters 3 to 5 minutes after each cartridge is administered before giving another. Take note that the use of non-steroidal anti-inflammatory drugs for more than 5 days may diminish the antihypertensive efficacy of most drugs used to manage hypertension. These can include any of the beta blockers. The next one would be calcium channel blockers. Calcium channel blockers are calcium channel antagonists or calcium are a group of medication that disrupt the movement of calcium through the calcium channels. Hence why they are called calcium channel blockers. Calcium channel blockers are used as antihypertensive drugs as medication to decrease blood pressure in patients with hypertension. Calcium influx is significant for generation of impulses in the sinoatrial and atrioventricular nodal cells of the heart. Calcium is also necessary for the contractile process of muscle walls. Calcium channel blockers are drugs that inhibit cellular entry of calcium ions. Therefore, calcium channel blockers are useful in managing angina, atrial arrhythmias, and hypertension. What are the common calcium channel blockers? The common calcium channel blockers are amlodipine, verapamil, nifedipine, and diltiazem. The newer generation calcium blockers are selective for L-type of calcium channels, thus its efficiency is enhanced. What are its dental implications? Calcium channel blockers are known to produce gingival enlargement, resembling that observed with phenytoin. Isradipine is a notable exception. Verapamil and diltiazem compete with macrolide antibiotics for the same family of metabolizing enzymes in the liver. Elevated levels of macrolides may result in cardiac toxicity. Verapamil and diltiazem may inhibit metabolism of benzodiazepines, especially midazolam and triazolam, resulting in greater bioavailability following oral administration and a longer duration of sedation. The next one would be antihypertensive drugs. Antihypertensives are a class of drugs that are used to treat hypertension, or also known as high blood pressure. Antihypertensive therapy seeks to prevent the complications of high blood pressure, such as stroke, myocardial infarction. To understand how these drugs work, we must first know where it is specified to work in. So, it works in the heart, which is composed of two principal cell types of working cells and specialized cells. Working cells comprise the muscle or myocardium of the atria and ventricles, while the specialized cells include the sinoatrial node and the atrioventricular node and his Purkinje system. What are the dental implications of the antihypertensive drugs? Epinephrine, antichlorogenics, and any other drugs that has excitatory influences on the heart should be used with caution on patients who present with a history of cardiac arrhythmia. Class 3 antiarrhythmics have potential to cause ventricular tachycardia. This potential is enhanced by macrolide antibiotics such as erythromycin. Amiodarone inhibits lidocaine metabolism, which increases lidocaine serum levels and lead to local anesthetic toxicity. Therefore, articaine would be a safer choice. Antiarrhythmic drugs. Antiarrhythmic agents are a diverse group of medicines that are used in the treatment of cardiac arrhythmias, also known as the abnormal heart rates or rhythms. Cardiac arrhythmias occur when there is a disturbance in the electrical conductivity of the heart. What are the modes of action? It can be used as a diuretic to induce the loss of water and solutes, and they reduce blood pressure and edema by increasing urine production. Dental implications. The use of NSAIDs for more than 5 days may diminish the efficacy of diuretics used to manage hypertension. The next one would be antiadrenergic drugs. An adrenergic antagonist is a drug that inhibits the function of adrenergic receptors. There are 5 adrenergic receptors which are divided into 2 groups. The first group of receptors are the beta adrenergic receptors. There are B1, B2, and B3 receptors. The second group contains the alpha adrenerceptors. There are only A1 and A2 receptors, also known as alpha 1 and alpha 2. Adrenergic receptors are located near the heart, kidneys, lungs, and gastrointestinal tract. There are also alpha adrenoreceptors that are located on vascular smooth muscle. What are its mode of action? Adrenergic antagonists increase blood pressure by stimulation of the heart and constricting peripheral blood muscles. Therefore, in hypertensive patients, adrenergic effects can be suppressed by inhibiting release of adrenergic agonists or antagonizing adrenergic receptors. Anti-adrenergic agents inhibit the activity of the sympathetic nervous system. They act by blocking adrenergic receptors in target organs or by inhibiting the synthesis, storage, or release of endogenous catecholamines, mainly norepinephrine. The next class would be vasodilators. Vasodilation is the widening of blood vessels. It results from relaxation of smooth muscle within the vessel walls, in particular in the large veins, large arteries, and smaller arterioles. Vasodilators lower blood pressure, improve the patency of coronary arteries, and reduce the work of the heart. Their ability to reduce venous return and arterial resistance is an obvious benefit when managing hypertension. Vasodilators act by many endogenous mechanisms. These offer a basis for subclassification. Next one is the anti-hyperlipidemic drugs. They are also known as lipid-lowering agents. Pharmaceuticals used in the treatment of high levels of fat in the blood. Total cholesterol and low-density lipoprotein are highly correlated with atherosclerotic cardiovascular disease. Modifications in diet and lifestyle can realistically lower cholesterol levels by 10%, but greater reductions require the concurrent use of drug therapy. The principal agents used to lower plasma lipoprotein levels include HMG, CoA reductase inhibitors, also known as the statins, bile acid binding resins, and nicotinic acid, also known as niacin. What are its dental implications? Macrolide antibiotics such as erythromycin and azole, antifungal agents such as ketoconazole should be avoided in patients taking any of the statins. Then we go to the antithrombotic drugs. An antithrombotic agent is a drug that reduces the formation of blood clots. Antithrombotics can be used therapeutically for prevention, primary prevention, secondary prevention, or treatment of a dangerous blood clot known as an acute thrombus. Thrombogenesis or clot formation includes two principal processes: platelet aggregation and coagulation. Antiplatelet drugs. Aspirin is the most commonly prescribed antiplatelet drug and is used to prevent arterial thrombogenesis. The antiplatelet influence of low-dose aspirin occurs when it contacts platelets within the hepatic portal system following absorption. Anticoagulants is another type. Warfarin and heparin are most effective in preventing venous thrombosis. Warfarin is the only oral anticoagulant in current use. It acts in the liver by inhibiting the activity of vitamin K, which is essential for the synthesis factors 7, 9, 10, and 2-protothrombin. What are the dental implications? Avoid metronidazole, tetracycline, and macrolide derivatives in patients taking warfarin as they can enhance its anticoagulant activity. Take note that the risk of gastrointestinal bleeding due to intake of NSAIDs is increased in patients taking antithrombotic drugs. Lastly, risks for significant hemorrhage are minimal unless extensive surgical procedures are planned. Communication with the attending physician is of utmost importance. Here are the reference for the lesson. And that's it. Thanks guys for listening, and this is M9 module drugs acting on cardiovascular system. Thank you.
Hello everyone, I am Ryan Angelo Gonzales, and at this moment I'm going to talk about emergency drugs, primarily those that are used in the dental practice. Emergency drugs are life-saving substances used during medical emergencies, as sometimes dental practitioners also encounter unforeseen nerve-wracking emergencies in their clinical workplace. Conditions such as syncope, hypoglycemia, diabetic coma, and convulsions, just to name a few, are those that spark medical emergencies. Emergency drugs in the dental practice was created to assist dental care providers in responding to medical emergencies effectively and safely, especially when there are no physicians available at the time. Let's dive deeper to what emergency drugs are. So, these drugs can be classified into two categories, the injectable drugs and the non-injectable drugs. There are three types of injectable drugs. The first type is the primary or essential, which include epinephrine, antihistamines, narcotic antagonists, and anticonvulsant. The second type is the secondary or non-essentials, which include analgesic, vasopressor, corticosteroid, and antihypoglycemic. The third type is the drugs for advanced cardiac life support that includes sodium bicarbonate, lidocaine, and atropine. On the other hand, non-injectable drugs include oxygen, vasodilating agents, respiratory stimulants, antihypoglycemic agents, and bronchodilating agents. Let's further discuss these emergency drugs one by one, starting with injectable drugs. First on the list under primary or essential injectable drugs is the epinephrine. Epinephrine injection is in a class of medications called alpha and beta adrenergic agonists. In emergency medical treatment, it is used to treat life-threatening allergic reactions caused by insect bites or stings, foods, medications, latex, and other causes. Second is antihistamine. Antihistamine injections or allergy shots are used to treat variety of conditions like severe allergic reactions, anxiety, nausea, vomiting, and motion sickness. The third one is anticonvulsant. Intravenous and intramuscular anti-seizure drugs are essential in the treatment of clinical seizure emergencies, as well as in replacement therapy when oral administration is not possible. Number 4 is narcotic antagonist. These drugs, which block the euphoric effects of opiates. Naloxone is the most promising narcotic antagonist based on ability to produce blockade, length of duration, and relative absence of side effects. Naloxone, or anti-narcotic drug, injection is used to treat a narcotic overdose in an emergency situation. Let's proceed to the secondary or non-essential type of injectable drugs. First drug is analgesics. Pain comprises almost 80% of the causes for referral to the emergency department. The primary basis for pain relief is the administration of systemic analgesic agents such as narcotics or non-steroidal anti-inflammatory drugs in an emergency. Second one is the vasopressor. These medications used to create vasoconstriction or increase in cardiac contractility, respectively, in patients with shock or any other reason for extremely low blood pressure. Third is corticosteroid. In an emergency, hydrocortisone injections are used to treat severe asthma, allergic reactions, severe shock due to injury or infections, or failure of the adrenal glands. Fourth is antihypoglycemic. Antihypoglycemic agents like glucagon is an essential tool for rapid response in treating severe hypoglycemia in type 1 and type 2 diabetes mellitus patients. Now, we will continue on the drugs for advanced cardiac life support, starting with sodium bicarbonate. Sodium bicarbonate administration is only recommended for cardiac arrest related to hypokalemia or overdose of tricyclic antidepressants. It is effective in the management of metabolic acidosis, as well as it elevates the pH of blood by combining with hydrogen in blood. Second one is atropine. The action of this drug is to block the effect of the vagus nerve on the heart. This nerve normally slows heart rate, and during cardiac arrest is a common cause of acetone. Third is lidocaine. Lidocaine is given to treat specific cardiac arrhythmias. Again, mainly ventricular fibrillation and ventricular tachycardia. It reduces the electrical activity of cardiac tissue and so is able to slow down a very fast heart rate. It seems like we discussed all of the injectable drugs. So let's now tackle the non-injectable drugs. To start with, number 1, oxygen. Oxygen is the most commonly used drug in emergency medicine, and when used judiciously in the treatment of hypoxemia, it undoubtedly saves lives. It is the most important drug in emergency. Patients with chronic obstructive pulmonary disease should be given with caution because apnea may result. The second one is vasodilator. Vasodilators like nitroglycerin improve hemodynamics in patients with advanced heart failure. Next is respiratory stimulant. Ammonia inhalants or smelling salts like the one that are used in the gyms of the weightlifters are used for stimulating consciousness. It can be used to help arouse consciousness for an unconscious or semi-conscious victim or to restore mental alertness during competition. Antihypoglycemic agents as number 4. Hypoglycemia is a medical emergency, and it is important for patients with diabetes and their close contacts to recognize symptoms of hypoglycemia and proceed with proper treatment. In the conscious patient, the most practical treatment is the oral administration of a rapid-acting carbohydrate like oral glucose. Here is bronchodilators are indicated for individuals that have a lower than optimal airflow through the lungs. Various respiratory conditions may require bronchodilators, including asthma and chronic obstructive pulmonary disease. So, we are finished discussing these emergency drugs one by one. Now, we should also be able to recognize the most frequent medical emergencies that usually occur in the dental office. This includes acute asthma attack, angina or myocardial infarction, epileptic seizures, diabetic emergencies, allergies or hypersensitivity reactions, choking and aspiration, adrenal insufficiency, and cardiac arrest.
As a health allied practitioners, dentists must also observe the salient details in emergency management. Key points in emergency management. The cornerstone of emergency management is the ABCD approach, which means airway, breathing, circulation, disability, and exposure. Emergencies can usually be anticipated by obtaining a thorough medical history. Once the nature of the emergency has been established, more specific management must be instituted, underpinned by the ABCDE approach. Talking about emergencies, being prepared is a necessity. Dentists must possess an emergency kit in their dental office. These emergency kits must at least include nitroglycerin as a coronary vasodilator, ammonia inhalants for syncope, glucose for hypoglycemic patients, naloxone as an opioid antagonist, epinephrine or those that are used to treat anaphylaxis resulting from severe allergic reactions, albuterol for an asthmatic attack, diphenhydramine used to treat non-life-threatening allergic reactions, and aspirin, which is administered as part of the MONA protocol when myocardial infarction is suspected. This table features the emergency drugs that we discussed earlier, their indication of use, and the prescribed adult and pediatric dosage as well as their route of administration. So, that ends our topic on emergency drugs. Again, I am Ryan Angelo Gonzalez. Thank you for listening.